Hi, everyone. I'm Amy Zelmer from Faces of TBI, and welcome back to the Brain Health Online Training Series. I am a TBI survivor from a fall on the ice in February of 2014, and myself, along with Dr. Jeremy Schmo from Minnesota Functional Neurology, we saw a big need in the brain injury community for more education and training on alternative healthcare methods for those of us who are still suffering from the lingering effects of a brain injury. Our goal is to help educate and bring awareness to this invisible injury that affects 2.8 million Americans each year and is the leading cause of death and disability worldwide. So each day you're going to hear from 4 to 5 speakers, and they're going to share their experience with you, either in working with a brain injury patient or their real life experience of living with a brain injury. And today I'm here with Judy Chase. Judy is the mother of an elite snowboarder that survived several traumatic brain injuries. Her son Matt was a sponsored snowboarder and national champion for USASA and PBRJ. He took second place in the Revolution Tour, just behind the Olympic alternative for Shaun White. Matt was on his way to becoming a professional snowboarder when his dream came to a crashing halt. With a series of brain injuries, Matt found himself giving up his snowboard for a dark, quiet room confined to his bed with a migraine. Judy has a message of hope, inspiring those with brain injuries to find treatment that actually heals the brain injury rather than just treating the symptoms. So welcome to the summit, Judy. I'm so glad to have you here.
Thank you.
So Judy, I would like you just to share Matt's story. You know, he had several traumatic brain injuries in his snowboarding career. If you can just kind of tell the background a little bit about what happened with Matt.
Yeah, you bet. Well, I'm excited to tell this story because just for those out there that have had a brain injury and you feel stuck in the recovery process, maybe you've reached a plateau, or maybe you've even gotten worse from once you've received the concussion. And I'm just excited to share our story because I feel like with our story, we offer hope and a solution of treating the problem, the root cause of a brain injury and the symptoms, rather than treating just the symptoms.
Yeah.
So the story starts in 2014 when my son Matt was a senior in high school, and he was having a great senior year. He was traveling around from state to state, California, Colorado, Utah, Oregon, to different snowboarding competitions. And he participated in 2 different events. It was a rail jam event and also slopestyle. And his first traumatic brain injury happened in March of 2014. He was at the national championship at Copper Mountain in Colorado, and he made it to finals. And he was going down for his last run of the competition, and he went off a jump, landed on a rail, and then slipped and fell 15 feet and landed on his forehead. And he was knocked unconscious for about 30 seconds and came to and flew home that next day. And that's when the migraines started. He also was sensitive to light and sound. And he ended up being confined to a room for 2 months after that concussion. Any stimulation increased his pain and his migraines. And so he had to be out of school for 2 months. And after about 2 weeks of migraines, we went to a concussion clinic. And that doctor at the time said, you know what, let's put him on a medication. And at the time, we didn't know it was actually a last resort medication. The name of the medication was amitriptyline. And we found out later it was a very dangerous medication that when you decide to go off of it, there's very dangerous side effects. And so Matt started getting better after about 2 months. And by the summertime, he was doing quite well. He had intermittent migraines periodically. And in June of that same year, he went to Wendell's snowboarding camp in Mount Hood in Oregon. And he was going down the hill, and he was just doing a routine trick. And he was explaining to us after he fell and got his second concussion. he said, wow, he goes, I just really felt uncoordinated. And wasn't a big trick. And later we had found out that when you experience a concussion, it causes major balance and coordination issues. And when you don't fix the problem, the injury of the concussion, you're more susceptible to other concussions because of this coordination issue. So after he got that second concussion, he had migraines for about 3 weeks, and he was sensitive to light and sound, and continued to have intermittent migraines like every other week. And it didn't last very long, but it was just lingering. And then in the fall, he went off to college, and he went to Westminster in Utah. He was on the snowboard team there, and he was training in December at Park City. And he went off a huge slope style jump. It was like 50 feet in the air off the ground. And he fell from that jump onto his face and again hit his forehead. And surprisingly, after that jump, after that concussion, he only had migraines for 2 weeks and was also sensitive to light and sound. And, so then he came home from college and healed up and started getting better. And he still experienced periodic migraines.
Was he still on medication?
Yeah, he was still on the medication, and we tried taking him off of a little bit, and we had some difficulty with side effects. And but where it really fell apart, he had these 3 major concussions, and if we spin ourselves forward to the next fall, everything fell apart. He was having weekly migraines at this point in time, and he was going to be going off to college. And my husband and I thought, you know what, let's look for another doctor. There has to be another doctor out there that can get to the root of the problem. So we ended up at probably one of the largest concussion clinics in Minneapolis, a very well-known place. And that doctor's perspective was let's double his medication because that will stop the migraine cycle. And at the time, we didn't know any better, so we thought, okay,
trust the doctor.
Yeah, exactly. And we thought we'll give this chemical experience one more try. So we unfortunately doubled his medication, sent him off to college. He was moving into his dorm room, and he bumped his head on the bunk bed, and all of his migraines and symptoms came back. And he couldn't start school that fall. He had to come home.
Wow.
And yeah, we took him back to that doctor and at the concussion clinic, and they actually wanted him to go on more medication. They wanted him to go on Depakote, which is a anti-seizure medication, which I guess can help with migraines. They wanted him to go on steroids, and they wanted him to go on another medication all at the same time as his amitriptyline. And fortunately, we refused. And then they said, well, let's try eye exercises. And so we thought, okay, well, we haven't gone down that route yet. Let's see what that will do. So he started these visual exercises, and actually his migraines doubled in intensity. And so at this point in time in our journey, Matt was in bed, confined to his room again, and his migraines were getting worse. And as a mom, I came to a breaking point, and I just, I didn't know what to do. And I just fell to my knees, and I just asked the Lord, what am I missing? And it was amazing. At that time, excuse me, 3 different people came to us within 1 week and told us about a doctor that we should see. They all said, you need to meet Dr. Schmoll. We went to the airport of all places, and we met a couple that had a son with that was treated by Dr. Schmoll with his concussion. My mother-in-law called, and she said, I have this friend that went to see Dr. Schmoll, and he really helped her. And then we had my husband and I's friend gave my husband a call in that same week and said, you need to see Dr. Schmoll. A friend of mine had a concussion and went to see him and got a lot of help. So, yeah, so we made an appointment with Dr. Schmoll. And we got there to our first appointment, and it blew us away because he had such a a comprehensive neurological exam, and it lasted for an hour and a half. And Dr. Schmo sat us down and explained to us that he needed to see how well Matt's brain was functioning. And he needed to find out the neurological pathways that had been damaged, and then develop therapies to stimulate those pathways with the goal of brain stability and plasticity. And so this entire exam covered neurological aspects, metabolic, and structural. And the different points of the neurological exam covered, tested Matt for his balance, gait and stability, and motor coordination, reaction time, vestibular and visual systems, auditory system, autonomic system, cognitive processing, structural integrity, and then had a metabolic assessment as well. And with the metabolic system, which is basically your gut, is not uncommon to develop GI issues after a concussion. And if your brain is inflamed, then your gut can also become inflamed. It's like a two-way street. Yep. And he said, you know what? Dr. Schmo said, I really think we need to look at Matt's metabolic system, and let's just rule some things out. Let's test, get some lab work done. Let's make sure he doesn't have any intestinal infections, and let's see what level his inflammation is at. Let's check his thyroid and to see if he's anemic. And so the next appointment, Dr. Schmo went over the results, and Dr. Schmo diagnosed Matt's root problem of his brain injury and what system in his brain that was not functioning properly. And actually there were a couple. And then along with blood chemistry, it was revealed that Matt had extremely high levels of inflammation in his intestines and with a possible GI infection. And then Dr. Schmo developed a detailed rehab plan for Matt for his diet. And he actually put Matt on a diet similar to the paleo diet. And then he also put him on brain-based supplements. And then Dr. Schmo explained that the medication that Matt was on, the amitriptyline, could be exacerbating his GI tract. And obviously at this point in time, it wasn't helping his migraines. And he just said, you know, it could actually be contributing to his migraines. And so we, continue to try to get Matt off that medication. And then Dr. Schmo talked about the neurological system and what systems needed to be worked on with Matt's brain injury. And he developed a rehab program that had different exercises for in the clinic and at home. And he said the key was to get all the neurological systems working together. And he explained that there's so many different systems. There's the auditory, the cognitive, the autonomic system, the auditory, there's just so many different systems. He says we need to bring those together and we need to integrate them and make sure that they're all working properly. And the biggest system that was off with Matt was his autonomic system, which is the autonomic system regulates the internal organs like the heart, stomach, and intestines. And so it's basically has a lot to do with your breathing mechanics. And Matt, when he would go from standing to a sitting position, his blood pressure would fluctuate abnormally. And Dr. Schmo said, this is so abnormal. We need to get this under control. And what was really interesting, the therapy that he prescribed for that is for 2 weeks. The first 2 weeks of his therapies, he was on a tilt table. And it's a device where Matt was raised up to a certain degree, and he was connected to, his heart rate and blood pressure was measured at all times. And he was raised up to a certain degree and then put back down. And it was just a continued process. And each time he came in, he went up a little bit further in his posture. And amazingly, after 2 weeks, it actually regulated Matt's blood pressure from standing to sitting.
And so, I just kind of want to interject with the tilt table. Yeah. It's not as scary as it sounds, because I've watched House and Grey's Anatomy, and the tilt table is like up, down, up, down, up, down. And it's like with Jeremy, it's like really slow. It's like I was really scared the first time he put me on the tilt table.
I know. I thought you were going to spring across the room. but yeah, it was really slow. And as I was watching it, I thought, is this really doing anything? But
Right.
it is a very scientific approach. And it after 2 weeks, I was amazed that Matt's blood pressure was regulated again. And so then uh, after getting this system under control, Dr. Schmoll wanted to start vestibular and vision exercises with Matt. And at that point in time, we're just like, oh, wait, Matt doesn't do well with vision exercises because he basically blew up his migraines at the last clinic. And we really didn't want to go there. And Dr. Schmoll explained to us that the reason why Matt's migraines got worse from eye exercises at the previous clinic was because the other clinic was not testing all the neurological systems. They were just focusing on the vision system. And he said, it's very important that you integrate these different systems at a predetermined time. And I think that's so wise of Dr. Schmoll, knowing exactly what system to start with and when to integrate it and when to pull in the other systems. And so Matt did start the vision and vestibular exercises, and he did just fine. He did.
Can you explain that a little bit when you say the visual and other systems at the same time? Like, how did he do that?
Well, like the vision, there's different dots that was like on this piece of paper on the wall, and he also emailed us these vision exercises, and he would go home and do these vision exercises as well. And then he would do these interesting barbecue rolls with Matt that would help with his with some dizziness and balance issues. And then he also gave him some complex movement patterns. They were like figure 8 patterns that he did with his arms and his legs. And then when he was at home, he'd use a hockey stick and do these figure 8 patterns with a hockey stick. And this particular exercise was helping him with muscle memory and retrain his brain. And then another exercise that they used in the clinic was Dynavision, this D2 machine. It's a light up reaction time board, and it helped integrate his visual and motor system in the brain, and it really helps with coordination. And then throughout the therapy, he also, Dr. Schmoll used soft tissue therapy and Prologel to help decrease inflammation. And with each patient, it's so different. One time I asked him, how many exercises do you have for your patients? And he just kind of laughed and he said, I don't know, over 100. And so obviously he's not going to give 100 exercises to each patient, but every patient is so individual and with what therapies are applied to their situation.
I get asked a lot what eye exercises I do because they'd like to do them. And I just tell them what worked for me might not work for you. Like, it's based specifically on what's wrong with my eyes. And it could actually make you worse if that's, not the same symptom that you're having. So it's extremely tailored to the individual and what their overall problems are.
Exactly. Yep. And after, it was only after 4 weeks, after all these therapies, Matt was retested. And Dr. Schmoll has so many different diagnostic tests. One being the VNG. It's where you put goggles on and it tracks your eye movements. And it's amazing. He explains how the eyes are a window into the brain. And through this device, and through the eye movements, Dr. Schmoll can actually see the different circulatories of the brain and where there has been damage due to because of a brain injury or another. Maybe it's not even a brain injury. It could be any sort of system that's been compromised due to even an illness. And so after 4 weeks, he was retested on several different diagnostic tests, and he scored a perfect score neurologically. And so that was awesome, but Matt's healing wasn't done yet because he was still out of balance metabolically, and he still had some symptoms. And at this time, Matt was still struggling with inflammation and his migraines. And we had we were trying to titrate Matt off the medication, but he had such severe side effects. Every time we went down just a little bit on a dose, he had anxiety and depression and even sometimes panic attacks. And that was not typically Matt's demeanor and personality, and he had never struggled with that before this concussion. And at this point in the treatment, Dr. Schmo referred us to a doctor that could help Matt titrate off the medication. And we ended up landing in Dr. Bush's office at Natural Medicine of Stillwater. And since concussions and medications can decrease your neurotransmitter levels, and those are the feel-good hormones, the serotonin and dopamine, these levels were raised up to a normal level, and then Matt began to slowly titrate down off this medication. And once Matt started titrating off this medication, his metabolic inflammation decreased, and he started becoming symptom-free. So, and this last year, Matt returned to college and without any symptoms and was enjoying life. But he's also learned a lot of life lessons through this, and he has learned a life skill of eating well and taking care of his body, and not to mention the tribulation of going through this journey, and I think it really impacted his character as well. And but I am so thankful for the foresight and knowledge of Dr. Schmo that he correctly diagnosed Matt's neurological deficits in several areas of the brain, along with Matt's inflamed metabolic system. And I would say at Minnesota Functional Neurology, our whole family, we learned such a valuable health principle that we're going to carry with us for the rest of our lives. We learned that the fastest way to recovery is by treating the root cause of the injury, not just trying to treat the symptoms.
And that's what the medication was doing. It was just trying to treat the symptom. So I have a question about that medication.
Yeah.
Is that medication designed like that's a migraine medicine? Is that what that was?
You know what? It was actually a tricyclic antidepressant that was very popular in the 1950s.
Wow.
And it is commonly used to help with migraines. I don't know if it ever really helped.
Yeah.
Maybe it helped the first, I don't know. It didn't start helping until at least 2 months into Matt's first concussion, although maybe he would have been just fine without it. But in retrospect, we realized that we were chasing after treating the symptom. And
you don't know any better.
You don't.
You trust what the doctors tell you.
Yeah.
I had a doctor wanted to put me on Ritalin and antidepressants and a sleeping pill. 3 things. All at once, all after meeting with me one time. And I mean, I'm thankful that I was at least in a frame of mind where I could say, no, thank you. I'm willing to give this a little longer before I turn to medicine. Because I knew that it's just a Band-Aid. It doesn't fix it. It just like masks the symptoms.
It is. And, if there's those that are listening that are in that vicious cycle of pain medication, I just encourage them, don't go off of it cold turkey.
No.
You need help. And there's a chemical imbalance if most likely that pain medication actually can, whatever medication it is that's treating the symptoms. Yes, sometimes you need some help with the pain, but at the same time, you have to be so careful because it actually can extend the healing process. And Matt would have been symptom-free after 4 weeks of treatment with Dr. Schmo if it wasn't for his metabolic system. So, so it was a little bit longer before he was symptom-free. But, and just thinking about the healing process, one more element I would love to add is that in all healing, the mind matters.
Absolutely.
And how you think, and you are what you think. And especially with concussions, it's very common for your neurotransmitters to get off. and especially if you're adding medication to it. And when your neurotransmitters are off, your feel-good hormones, it affects how you think. And it can become a vicious cycle. Anxious thoughts can drive your pain, can drive you symptoms physically, and then you end up almost fearing pain. And then it's just a vicious cycle that increases your pain. And in Matt's journey, he reached a point where he came to me and he said, Mom, I'm no longer going to fear my pain, and I'm going to start living life even if I have to fake it.
Aww.
And that, I know, and that was when he was having migraines. And that mindset propelled Matt toward complete healing. And it made me and my husband really think. We thought, okay, wow, we need to have this same attitude. And as a caregiver, it's important to stay positive. And looking back, I would love people to learn from our mistakes. He'd wake up in the morning, and sometimes the first thing we'd say to him is, how are you feeling? And we would ask him, what's your pain level at? 0 to 10. And we cared, and he knows we care. But knowing his level of pain isn't going to change his pain. Right. It's only going to focus on his pain. And we needed to change the focus to healing and a positive attitude. And so we started doing that as a family. And so I just encourage those out there to stay positive, because the mind impacts the physical.
That's such great advice. Yeah. So what did you change so every morning you'd ask him how he's feeling. What did you change that to?
Hi, Matt.
Yeah, not even addressing it.
Yeah, we could tell by the way he was acting how he was feeling. So it was a private conversation between my husband and I about how we thought he was doing. But we really stopped asking him. And, and every once in a while we would say to him, hey, Matt, we just want you to know that we care, but we're purposely not asking you because I think, we just reiterated what he said. We just said, we want you to stop fearing your pain, and we need to stop talking about it and letting it rule our lives. And, I think God has given us a body that heals. And sometimes things happen where that healing process, something stops it. And I think, I don't know, I think God puts certain doctors in our path to help us along. And that mind and our attitude really impacts that healing. And many times when we go through journeys like this, we always wonder, why is this happening? What fruit is going to come from it? And sometimes we don't know till later in life. But one thing that I'd love to share, it's really fun because now I'm working for Minnesota Functional Neurology as Dr. Schmo's office manager. And I am so excited to do that because I love encouraging and giving hope to patients and empowering them to attain full recovery from their brain injury. And patients will come in and I'll ask them, so what's your goal with your health? And it's amazing because many of them will say, I just want to improve by 20%. And I just encourage them. I say, you know what? Why stop at 20? Let's go to 80, 90. Why not 100% better? Mm-hmm. Let's not sell ourselves short. And I also love seeing patients get better.
Yeah.
And one program we offer at our clinic is a week-long intensive program. And a few weeks ago, a family came in, a mother and father brought their son in, and he had a traumatic brain injury. And he would come into our clinic for 3 therapies a day, 1 hour apiece, so 3 hours each day for 5 days. And when the family came in, I looked at their faces on that Monday, and they had such a discouraging, hopeless look, and the son looked like he was in pain. And I really felt for them because I knew what place they were coming from, and I related to them. Mm-hmm. But what was amazing was by the end of the week, the mother, she turned to me and she said, I have my son back, and his personality is back. And he was symptom-free by the end of the week. And And I just love the transformation going from the point of discouragement and hopelessness to a place of healing and hope. And there's nothing like that, watching that transformation.
Yeah, you've been on the other side of that desk and you know what it feels like. And that just makes you such a good patient advocate at the clinic.
Yeah, I really enjoy it.
When Jeremy first approached me, because he actually found me through one of my Huffington Post pieces, and he's like, please come see me. I know I can help you. And I just kind of blew him off. I'm like, nobody else has helped me. I was 2.5 years into my journey and nobody was helping me. And it took me a few weeks and I was like, what do I have to lose? Like, it's not going to hurt to go see him. And I had like an 1.5 hour, 2-hour consultation with him. And he was like, yep, it's your eyes. Yep, that's what's affecting your dizzy and balance. Like, it was just so validating to have someone that, he just validated what I was feeling. And he's like, this is how we're going to treat it. And, the eye exercises and some of the figure eights. And he did a lot of like electric stimulation on the left side of my body. Because, I was 2.5 years out. My body had been lethargic for 2.5 years, right? Like, those neurons weren't firing. So I just, I have such respect for him and all the other functional neurologists. It's like, they get it. And if they can't figure out how to help you, they will find someone who can.
Exactly.
Like with Matt and his meds, like, Jeremy couldn't help him get off the medication, but he found someone who could help him do that.
Yes. Yeah. And I love how it's a community that actually helps you.
And he absolutely cares about you. And he wants you to get better. He doesn't want to have to see you again, right? Like,
no.
In a good way.
Right. No, exactly. Yeah. So after Matt was off his medication, I actually brought him back there and retested him just to see where he's at. And he's doing great. And after a year of being at college, I'm just going to bring him back and get him retested. And, I think what's really interesting is, I'll have some patients call into the clinic and ask me, so if I come in and go through all this therapy, is it long lasting? And that's a great question. And it is. And I see that with my son, that it, neurologically, he's doing great now. And and he's doing, he's not competing with snowboarding, but
I was just going to ask you that.
Yeah, he did hang up his snowboard. I mean, he'll snowboard for fun, but not competitively, just because he has such a competitive mentality that he can't turn that down.
Yeah.
But he does crazy things like slacklining across the canyon. He's all cabled in, but he needs his
adrenaline fix.
What was that?
His adrenaline fix.
He does, and he needs that balance and coordination too, and he has it now. It's back.
And I know one of the first times I met you, I had just returned from my month-long trip out east to Washington, D.C. and everywhere for Brain Injury Month. And I remember, so when I was out in D.C., I had some things that kind of triggered my eye stuff again, which I was very aware of what was happening. And I did some of my exercises, but I was off the rest of my trip. And by the time I got back, I was just like, ugh. And I remember that was the first time you met me. And I was just like, just don't talk. but to my point, so I think I'd been 6 months symptom free. And then I had a very specific incident that triggered it. It reflared it up. But we were able, one treatment with Jeremy, and it brought it back under control. So it's definitely long lasting. And, if you do have a flare up, you can do those exercises again.
Right. And he equips the patients with exercises. So if you do get a flare up and you're not, close to his clinic, you can do these different exercises at home and help yourself to get back on track, and then to just always keep him as a base to train with them if you do have a flare up.
Yeah. So do you have any final thoughts, any final words of wisdom for our listeners?
Yeah, I guess I would give 3 takeaways. I would, if you're struggling with a brain, if you're listening to this, there's a reason why you're listening to this. And I would find a doctor like Dr. Schmo at Minnesota Functional Neurology that can diagnose and treat the root problem of the brain injury, not just the symptoms.
Yeah.
And you could go to Dr. Schmo's website at mnfunctionalneurology.com. There is a link to an 18-page ebook and how to find the best concussion and rehab care. Maybe you're out of state and you want to find the closest one. We do see patients all the time from different states, but possibly there's someone that's been trained by the Carrick Institute as well that's close to your location. And that link is very valuable tool. Mm-hmm. And then also just remember, there is a way out and there is hope with the right treatment.
Absolutely. Yeah. Thank you. That was such a great story, such great advice. I really appreciate you taking the time to be here. I know people are getting some great information from the summit. So thank you so much, Judy. We appreciate having you and sharing that story.
You bet. Thank you, Amy.
And thank you, everyone, for watching. I hope that you have taken away some golden nuggets from Judy and Matt's story. And just remember that you are not alone in brain injury. And also, if you are not able to catch all of these live interviews, you do have the option to purchase the recordings for $29 with proceeds going directly to the Brain Injury Association of America. So I will see you all again next time. And thanks again, Judy.
Thank you.